Operation Bridge is a governor-led initiative where we are bridging the law enforcement and recovery services together in a community. So it's extremely important that we work together to help solve the supply and demand in our community.
Over the past few decades, Scioto County has been hit hard, starting off with crack cocaine, switching to the opioids. Now, since the opioids are harder to get to, it has switched to meth, and of course with the meth you have fentanyl mixed with that, which is a very dangerous combination. About 90% of the arrests made involved some type of drug. It's directly or indirectly, it's all related. Your robberies, your B&Es, thefts, all out trying to make money so that they can purchase their narcotics.
This initiative is not about not holding people accountable when they're bringing drugs into our community. So to make that clear, people still will be held accountable when they are drug trafficking and bringing these deadly substances into our community. We also know, though, by offering treatment to low-level offenders who are suffering from the disease of addiction, that's really the more appropriate path for those individuals. We need people to have the opportunity to engage in high-quality treatment and to be offered that opportunity for recovery rather than spending time in the criminal justice system.
So what we've asked is the task forces and law enforcement we support at DPS, at any time a drug dealer or drugs are diverted from a community, that they reach out to us, and we reach out to the outreach in that area to have them be proactive. We found that the overdoses has the ability to increase, and by us doing this we have an ability to maybe lower those overdoses from happening.
Most of the majority of us, or a lot of us, are recovering addicts. So we've been there, we know what it's like, and back when I got sober 15 years ago, none of these resources was available. So to see how much resources are available today is truly amazing. To see the Portsmouth Police Department working with addicts, Sheriff's Department working with addicts, the State Patrol working with addicts, trying to get them help, because 9 times out of 10 you commit a crime because you're under the influence.
We have been making arrests for many years, trying to arrest our way out of this. I believe it's very important that we try to break that cycle, and Recovery Ohio and Operation Bridge is a very useful tool in doing that.
On one of the calls I went to, she was really scared to come. She was scared of the officer that was there. I don't know if I'm allowed to mention, but it was Officer Kreckler, and he was very kind and compassionate with her. He actually stayed there with us for an hour until this girl was finally not afraid to go to treatment. You know, because they are afraid. They do get a negative impact from their past experience, and 9 times out of 10 it's stuff that we've done and created with law enforcement to supply our habit, you know, so they do see us at a negative light. So now for them to actually care and have concern is amazing, and they are doing it. They are doing it in this area, and it's amazing.
This is a program that we can get local agencies involved in that doesn't cost extra manpower, doesn't cost a lot of funding. And so, you know, they can come and do these and not dedicate one person full time to this. We can get together a few times a year and have these results. So you look at Ross County, they average about 6.5 overdoses per week. 4 weeks after the detail, they were down to 1.5 for those 4 weeks. Over in Lawrence County, they average between 20 and 25 a month. We did that one over there on the first, like the 4th of the month at the beginning. They had none prior, and they never had another one entire month. So now, you know, things do go back to normal after that period of time. But for, you know, when you're looking at that 4-week period, how many lives were saved?
Our team now is going to start doing follow-ups. We're going to go back out into the communities. A lot of other QRT teams have already done that in the past, and the new QRT team that they have will be doing that as well. So for those who do not want treatment right then, we're going to follow up with them. Just let them know that somebody cares. There's somebody out there in the community that loves you, don't know you, but they want to see you live, and that's us.